Perfect. All right. So good morning and welcome everyone to the Best Practices for HIV, STD, and HCV Testing Programs webinar. This webinar is very focused on either beginning and or maintaining an HIV testing program, and it's for contractors funded by the New York State Department of Health, AIDS Institute Division of HIV and STD and HCV Prevention. Excuse me. I'm Christy Carey. I'm the HIV testing coordinator with the division. I'd like to start the training by turning it over to our director in the division, Julie Harris, who would love to make a quick announcement. So welcome, Julie, and we'll turn it over to you.
Great. Thank you, Christy. Welcome, everyone. I just wanted to say a few words at the start of this webinar. Over time, the last couple of years due to COVID, across New York State, we have seen HIV testing numbers decline. A lot of it is due to COVID. Obviously, folks, the first several months when COVID hit, people stopped in-person services and, a lot of folks then rebounded and were able to start back up, but we have not seen the increase yet back to pre-COVID testing levels. I don't know if we will, but our division, is very heavily focused on HIV testing and helping people understand and learn their HIV testing status or their HIV status. So throughout 2022, we've done a series of webinars on best practices for HIV testing, and Christy's done DBS training. One thing that we've seen is that a lot of our agencies have had a lot of turnover in their staffing, and that some of the institutional knowledge around HIV testing, has gone with some of those staff that have left. So we wanted to provide a webinar to sort of level set, the basics of what agencies need for operating an HIV testing program. There are a lot of regulations and a lot of different policies and procedures and things that you need to have in place in order for us to be able to sign off on your testing program. And when we come in and monitor, sometimes we see that those things aren't necessarily in place or haven't been maintained. So that's the point of this webinar, is to Christy to give you the baseline. The other thing I just wanted to say is it's really important for agencies to have oversight on a regular basis of their testing programs. And so if you currently don't have someone who is designated as, sort of your testing guru, your testing supervisor, we really strongly encourage you to have someone in place that can do the quality assurance and quality oversight of the testing programs, so things aren't missed. Things like temperature controls, or having the proper materials in place, or making sure your CLIA waiver is not outdated. Because we have seen in the past where we've gone in for monitoring and things aren't in place, and we have to immediately shut down the testing program. And that's something that we don't want to do. So the spirit of this really is to hopefully provide you with the basics that you need. Christy is our HIV testing coordinator for the division. And between Christy and your contract managers, we can also provide the resources and technical assistance that you need. So I just wanted to say those few words. I want to welcome everyone. I do see a lot of familiar faces and names, so it's nice to see those folks that I know have probably been testing for quite a while. I appreciate you for coming to this, so that, it just shows that you have continued commitment. And I just want to welcome everyone that's new to the testing world. And I hope that you get the information that you need from this. So that's all I wanted to say. Turning it back over to Christy, and I hope you get a lot out of this webinar.
Thanks, Julie. All right, so we'll go ahead and get started, everyone. Okay, so some logistics. I said this in the chat before, but just as a friendly reminder, please put your name, the agency you work for, and your work email in the chat. We want to make sure we can keep track and verify that you were here. Also, after the training is over, probably a few days after, we're going to be creating a PDF of this training and sending out the slides to everyone that attended. So please make sure that if you like the slides, you put your email in the chat so that I can save the chat and make sure to get the slides out to everyone from this training. Especially if you have folks that couldn't attend, excuse me, you may very well want to send them the slides so that they can look at them as well. Please mute yourself unless you're speaking for background noise. If you have a question, feel free to type it in the chat, unmute yourself, raise your hand, which is under the reactions section with the little hand raise. I'd like to introduce my coworker, Liz Greenwood. Liz, did you want to just pop in and say hi real quick to everyone?
Hi, everyone, and welcome. I'm here. If you have any questions, you can type them in the chat.
Thanks, Liz. So Liz, as she said, will be moderating the chat, and I'll pause after every couple of slides too to see if there are any questions. All right. And once again, I apologize for my raspy voice. I am under the weather. Okay. Excuse me. So our training agenda for today is to go over limited service laboratories, which you'll hear me refer to as LSLs, which is what all of you are that provide testing under the department, our division of HIV, STD, and HCV prevention. We're going to go over CLIA numbers, clinical laboratory improvement amendment numbers. We're going to switch gears and then go over program requirements for HIV testing in non-clinical settings, supplies needed for your agency's testing room and in-office or community-based, not in-office testing, and then some trainings that are recommended for staff and supervisors who oversee testing staff. Okay. So the very first step. So if you are new to testing and you're interested in providing testing, this section is going to be great for you. So applying to become a limited service laboratory, that is the very first step. Applying, or if you already have an existing, renewing and making sure you renew that LSL registration certificate. And we're going to go into all of that. The first part is going to be about initial LSL registration certificates if you're a new testing program. And then we're going to go have a couple of slides on very specific into renewals for those of you who already have a testing program. Okay. So applying to become an LSL, right? So you want to come, can you all see my cursor, my mouse, if I'm moving it around? Okay, great, thanks. I'm on two screens here. I want to make sure you can see it. So you want to complete and submit the application. You can find the applications here. Instructions are printed out with the form. So the first 2 pages are actually instructions and not the actual form. The form is the last couple pages. Please take note for testing at multi-site locations. You must complete the initial registration, the DOH 4081, and the multi-site network application, which is the 4081 MS for multi-site. Complete a 4081 MS for each additional site. So for example, let's say, because I'm here in upstate New York, let's say the agency you work for has their main primary office is Albany, and then you also have a Schenectady office and a Troy office. And we'll go over into what makes a multi-site or what categorizes as a multi-site. If you want to categorize as a multi-site and you meet all the requirements, which we'll go into, you would then need to complete the initial, the DOH 4081 for your, let's say it was Albany, your primary site. Then you would need to complete the 4081 MS 2 times, one for your Troy office and one for your Schenectady office. Does that make sense? And then you submit all of them together. So if you have 3 sites total, you're going to do your initial form. And then for your, what maybe you could call satellite sites, your additional sites, whatever you call them, you would complete 1 form per site. And we're going to go into how you complete those forms. So for the initial link is found here for the initial 4081, and then the multi-site link is found here. These are all active. So you can easily, when I send the slides out, click on these links that will take you right to the forms. So just as a reminder, this info is for registration initially, but not renewals, but we'll go over renewals in a little bit. Okay. Okay, so when we're talking about what's the difference between can I qualify as a single site or a multi-site? To qualify as a multi-site, your additional testing sites must have the same ownership, agency name, tax ID number, and lab director as your primary main site. So I'm going to use that example again of if my main site was Albany, my Troy and Schenectady sites would need to have all of the same information here as my main primary Albany site to be able to register as a multi-site. If these do not match up, let's say you have a different name or a different tax ID number, you cannot register as a multi-site for that site. So single site registrations have a $200 application fee per site. but multi-sites for nonprofits are required to submit the $200 application fee once if all of these match up per site. I'm going to pause here for a second because I know that can be a little confusing. Are there any questions on that? Because I know it's a lot of jargon for folks that are new. Okay, no questions. That's a good thing. And it is totally okay if you have questions. So please feel free to stop at any time and ask questions. All right. So these are some screenshots and some tips for filling out the LSL, the Limited Service Laboratory Registration application. I didn't screenshot every single section. And the reason why is because some of them are very self-explanatory, like your agency name. But what I did do was create slides over the ones that may seem a little bit tricky or things that maybe folks may miss when they fill this out. So for example, and this is the initial 4081, not the MS for multi-site. So if your agency performs testing in the community, make sure that you're checking yes. So for example, you provide testing in your office, and then you also provide testing at drop-in centers, homeless shelters. You go to maybe Pride Festival, other cultural festivals, and set up your testing there. And or let's say you have a mobile testing RV/van, however you call it. That would be taking your show on the road, right? So if you want to take your show on the road, or you do take your show on the road, you want to make sure that you're selecting yes for performing community screening events here. If you do not select yes or leave it blank, then your registration will have to be redone, or you won't be able to be allowed, according to this registration certificate, to take your show on the road, for lack of a better word. Okay. Next, the lab type. So almost all of you are nonprofit, non-clinically based agencies and would be selecting 06-3A community clinic. If you do not identify as like a nonprofit, non-clinical, and you fit into one of these other categories, absolutely select that. But the majority of our folks here under the Division of Prevention would be selecting community clinic. As I mentioned before, if you have a mobile testing RV/unit that you provide testing from start to finish, you're also going to want to select 9-15 mobile laboratory. Pardon me. When I say test from start to finish, what that means is, let's say you have a mobile RV that you drive around, you park at different spots, you provide testing. If you're providing rapid HIV or rapid HCV testing, client comes in, provide the testing, prick their finger, and you wait the 15 or 20 minutes or the 1 minute, depending on what testing technology you're using, and the client's with you and you provide the results to the client there. That is from start to finish. Does that make sense to everyone? Okay. Are there any questions, or do folks have any questions or thoughts on if they might potentially choose another option? Okay, we got a quiet group this morning. So, all right. The next, moving on, section 5. These are some of the things that even I, in the past, have gotten confused on. So I was like, well, let me just make sure I put them in here. You're going to want to leave affiliation blank, as all of your agencies use Wadsworth as their processing lab. If you do not use Wadsworth, then of course you would want to fill this out. But almost all of you that I'm aware of use Wadsworth as your processing lab. Okay, section 6, management. Most of you would leave this blank unless the staff providing tested are contracted out. So for example, if your agency has a contract with staff not employed by your agency to provide testing services, let's say you call some RNs in from a hospital and your agency contracts with them and they're the ones that provide the testing services, but they're not employed by your agency, then you would fill this information out. But if your folks providing tested are employed by your agency, you would leave this blank. Okay. And this is where it gets a little tricky. So Section 8, the waived test procedures requested. Not everyone provides all these types of tests. I'm going over the plethora of tests that a lot of our folks provide, but not everyone does. And that's okay. Like you might provide HIV, but not HCV, and that's okay. You would only select the ones you're using. So for example, if you provide HCV rapid and HIV rapid, you're going to want to check these two. There's no option yet for that syphilis rapid health check, but CLEP's aware of it and they are working on it. It doesn't mean you can't perform the test, you can, but there just isn't an option currently on the form. Thanks for bearing with me. Okay. Next, this is the one that I found the most tricky in the past when I filled this form out. My original thought was, well, we provide chlamydia and gonorrhea screening, right? Via urinalysis. We have people urinate in a cup, or we might do 3-site testing, so forth, right? We should be checking urinalysis. You actually do not want to check urinalysis here. And the reason why is because having a client provide a urine sample, which you then put in a test tube and you send to Wadsworth, is not actually performing a test. It's collecting a sample and sending it to the lab. And the lab, Wadsworth, is the one who actually does the test. Does that make sense? So that's why your LSL is really for tests that your rapid tests that you're providing from start to finish. Your LSL is not for your DBS, your dried blood spot confirmatory, because that's also a collection card in where the test is being sent to Wadsworth and they're performing the test. So basically all you need to know is don't check your analysis because long story short, you're actually just collecting a sample and not running the actual test, if that makes sense. All right, down here below, this can be a little confusing too. Indicate the combined estimated annual test volume for all wave tests. So basically, no matter how many sites you have, you want to tally all those up. So for example, if I decide I want to do 100 rapid HIV tests in a year and 25 rapid HCV tests, hepatitis C virus, I'm going to put 125 in here. And that's across all the offices. So let's say I'm going to do 25 at one, and 50 at another and 25 at another, because I have 3 offices. That's still going to add up to 100. They don't want you to break down the type of test in here. They don't want you to break down the office. They literally just want you to tally across all your sites, all your testing locations. Especially if you categorize as a multi-site network, you're going to want to add up every type of test. And once again, that would just be your rapid test. So that would be your HIV rapid, your hepatitis C rapid, and your syphilis rapid. And they want you to just add up those numbers, tally them up, and just put a number right here. Because like for me, I'm thinking, oh, well, maybe I should separate it out by office, and maybe I should separate it out by the type of test. Like Albany office, I provide this many HIV, this many HCV, and then, for them, the folks at CLEP, it gets very confusing, and they really just want the total number. So are there any questions on that? Okay, great. We'll move on then. And once again, it's even if we've moved on, if you have questions, it's totally fine. Ask away anytime. Okay, so now we're going to move on to filling out the 481 multi-site registration. So the only things that are a little bit different, that form is shorter. If you're filling out your initial and then also your multi-site for each site, one form for each additional site. You want to make sure, because this looks a little bit different. This is at the top of the page instead of the bottom on the other form. Once again, you want to make sure you're clicking yes, because you're adding an additional site. Because if you're clicking no, then you wouldn't fill out this form, right? Okay, next, same thing. This is on a different location on the page. If you're going to be performing community screening events, taking your show on the road, for lack of a better word, you're going to select yes here. So those are just 2 things to make sure that you really want to check and select on your multi-site form, which goes along with the original form. Okay. So just some slight tips for filling out your registration application, whether it be initial or renewing. You want to make sure you enclose that $200 application fee, which is also required at renewals, in the form of a check or money order. Make your checks or money orders payable to the New York State Department of Health. Excuse me. And indicate your agency's name on the check or money order. Your lab director must be a licensed healthcare practitioner or provider holding a certificate of qualification. This would probably be what you know as your agency's authorizing physician, the one that's signing off and allowing you to order those tests. You do need to make sure that your lab director is submitting a copy of their New York State professional license with the application. All signatures on the form must be original. I know a lot of physicians use signature stamps. They can't use them on this. It has to be original, and the original form must be sent in. So unfortunately, your physician can't sign it and then fax it or scan it and email it over to you. You'd either have to pick it up or have them mail it. That really does require that the original, you can make copies for yourself, of course, but when being mailed in and being renewed, it has to be original form, original signatures. Okay, so pretty simple. This is the address that you're going to return your completed applications and corresponding documents. Put everything together, all the things that go along with it, which are in the instructions, and send it to this specific address. Okay, here's my favorite slide. So you might be saying, when do I get my CLIA waiver? What's a CLIA waiver, right? Because we all kind of misuse and miscall the LSL registration certificates a CLIA waiver. It's not actually a CLIA waiver. That's just what we call it. What you're getting is an LSL registration certificate with your agency's CLIA number on it. All of you are limited service laboratories. It basically requires you to conduct only the limited service tests that you put. So if you selected HIV rapid and HCV rapid, those are the ones you're conducting. You can't conduct anything that you didn't select on the LSL registration form. That goes for renewals too. Kevin, I see you had a hand raised. Do you have a question for me?
Yes. So this is actually Michelle this time, but the question is, back on the other slide, when it was saying for the providers, it can be, so am I correct that the providers can be a physician, a podiatrist, a dentist, a physician's assistant, a nurse practitioner? It doesn't just have to be a medical doctor.
Correct.
Okay, thank you.
Correct. I will say though, of course, they do need, you do need to make sure that that person is authorized to order tests.
Okay.
So for example, a dentist may or may not, a podiatrist may or may not. I mean, they're still, physicians. So you just want to make sure. So great question, Michelle. Thank you. You just want to make sure that they are able to order tests, because having them sign off as your authorizing physician, they need to be able to do what you need them to do. Does that make sense?
Yes.
Great. Thanks. Great question. Liz, did I miss any questions or any hands that are raised?
I don't see any more.
Okay, great. Thanks. All right. So we'll go back to where we were. All right. CLIA waivers, right? So, I think, so like, I used to call it a CLIA waiver, right? Everybody calls it a CLIA waiver. I'm going to try to force myself to refer to it as an LSL registration certificate, because the folks at CLEP, they know what we mean when we say CLIA waiver, but that's not actually what it's called. So just let's all try to get ourselves off the CLIA waiver choo-choo train and just start kind of putting in our brains LSL registration certificate, LSL certificate, LSL, anything like that. But it's not technically a CLIA waiver. I just think, I spent 12 years in the field before coming to the Department of Health. So that's what I referred to in the past too as well. So I totally get it. That's what we've all called it. But hopefully this will help clear up some of that it's not actually a CLIA waiver. It's the LSL registration certificate that has your CLIA number on it. And your CLIA number is what allows you with the certificate to conduct these certain specific tests. All right. Okay, so once you've submitted your application and all of that, you will receive a certificate documenting your registration status. Like we said, it'll have your CLIA number on it. Those certificates are valid for 2 years. If you're applying for the multi-site, The registration certificates for all sites will be sent to primary location. So using the example again, if my main office is in Albany, all of my certificates are going to be sent there. And then I have to make sure that Troy and Schenectady offices get their specific registration certificates. And we'll go into how they look a little bit different. Once again, you may only perform the tests listed on your registration certificate, and they have to be CLIA waived tests. These all here below, I personally would probably choose this one. It's the easiest right here, the particular kit or manufacturers, but you can use any of these links to double check that the testing technology you're using is CLIA waived, because it has to be CLIA waived. Okay. Any changes to your LSL registrations? And the next couple of slides are kind of similar. Please make sure you're submitting them to CLEP, the Clinical Laboratory Evaluation Program, within 30 days of the change, right? So if your lab director, who is your authorizing physician, most likely has changed. Your lab owner, which is your agency owner, right? So we're saying lab because you guys are CLEP is identifying you as a limited service laboratory. We identify, right, as agency or provider, but it's the same thing. So if your agency ownership has changed, your agency location or address has changed, you want to add or delete the type of tests that you're providing or a change in your agency name, please make sure that you let CLEP know that within 30 days or less. It's super important. This link here will take you, if you scroll down to this section, will take you to where the change forms are that you can fill out and submit. All right. Any amended registration certificates will be mailed on the effective date of the change, but test additions and deletions don't go into effect until an amended certificate has been issued. Okay. I know it's a lot, so I apologize. It's a lot of information. All right, so like we just mentioned, certificates are valid for 2 years, so that now we're talking about renewals, right? So for those of you who every 2 years need to renew your LSL registration certificate, which you know as your CLIA waiver. So 3 months before, you're going to be sent documents via paper to renew your LSL registration. And if you have a multi-site, they'll both be in there. Once again, ensure to keep CLEP updated on any changes, because if your address changed, the email changed for the person who was handling all of this stuff at your agency, they don't know that and they need to know that. And as we know, there can be high turnover rates. So please make sure that you're keeping CLEP updated on this, because otherwise all your renewal documents could be sent to the wrong person or the wrong location. So please make sure you make them aware of any of these changes here. Once again, your renewals must be returned by mail only with the application fee, and they'll be mailed 2 weeks prior to your current certification expiration date. If you haven't received your documents 3 months prior, you can absolutely reach out to this email right here, cleplimited@health.newyork.gov. This is a great email if you also have questions about the registration process. So please feel free to copy this email down. I'm going to have it in a later slide as well. This is a fantastic email to reach out to. It's basically the individual that handles this email only handles LSL, limited service laboratory questions. So this person knows everything there is to know about LSL laboratories, which is all of you. Okay. All right, so we're going to take like a 2-second break. And before we switch gears, I'm going to pause, see if anyone has any questions before we move on, because that was sort of the very technical piece. Okay, so we'll take like 1 minute to see if anyone has any questions. Michelle, did you have another question?
Yes. So if you have a change in like who your laboratory director and you have to submit that form, is there a charge for updating? Okay.
Nope, great question. Nope, there's no charge for updating or changes.
Thank you.
Got it. Okay. All right, folks, I'm just going to pause for a second. And please let me know if you have any questions before we move on to program requirements for HIV testing in non-clinical settings. All right. I don't see any questions so far. So we'll move on. Okay. So this section is, we're really just going to go over, these are, I mean, this is for both. It's definitely for folks who are starting up a new testing program, but also for folks who have a current testing program and are maintaining it to make sure that they have the requirements in place. Okay. So if you either have a testing program or are looking to start a testing program, you need to make sure that you have either prior experience in conducting testing, or that you can demonstrate the capacity to provide testing activities and services. A successful history engaging and working with your priority populations that you serve. Make sure that specimens are collected and processed under a licensed healthcare practitioner. This practitioner can be an employee or any medical provider with whom the agency has a contractual or referral relationship. So some of you have physicians on staff, and that person can absolutely be your lab director. It doesn't have to be someone that's outside of your agency. Your valid LSL registration certificate with your CLIA number, your approved laboratory quality assurance protocol, making sure that you cover handling and transport of all the specimens, your appropriate liability insurance, procedures for contacting persons tested with results, and linkage to treatment to those who come back reactive or detected, and then meeting disease reporting requirements. Okay. All right, so here is a list, and you will get these slides after, so no worries. Here is a list of the policy and procedure requirements for contractors providing HIV testing. So some of you may choose to have one big counseling, testing, and referral, CTR, P&P. Some of you may choose to have mini P&Ps for each one of these. Doesn't matter how you do it, as long as your policies and procedures, your P&Ps, include all of these here. So I won't go through them all, but I'll give everyone a minute to just take a look at this slide. And you'll, as I said, you'll get the slides, so you don't have to write any of this down. As long as you put your email in the chat. I just want to mention below, making sure that all staff are trained on all of your testing policies and procedures, and their training is documented. It's very important. So, you know, a lot of places have training logs or specific, however you do it, however your agency does it, as long as you're documenting that before testers are going solo, that they are tested on all of these things. And then, of course, we have annual refreshers and competency checks, but we'll get into that. Okay. All right, so testing room setup. If you've attended any of my other trainings, you've seen these already, but it's just quick for, this is really, you know, for folks who maybe need a refresher or are newer to testing. So you must have a copy of your LSL registration certificate conspicuously displayed at each testing site. If you have multiple testing rooms in one office, it's probably best practice to have a copy of your LSL registration certificate in each room, but it's not required. As long as it's displayed conspicuously, you know, in that main area of your agency, that's okay. Remember to post the LSL registration certificate that corresponds with the testing site address. So for example, like we talked about before, let's say this would be your main address, but this is the, let's say it was a Glens Falls office. This would be your Glens Falls certificate. So all of your LSL certificates are always going to have your primary site listed at the top. And then below it, if it's a multi-site, your multi-site address will come second. So, because that can be a little bit confusing sometimes. So make sure to look at both addresses. If it's just one primary site, it's just going to have the primary site. But make sure to take a look at both. And then you'll know, okay, the second address, this is for my Glens Falls office. This is for my Bronx office, for my Troy office, for my Plattsburgh office, wherever you are. You want to make sure that each original LSL registration certificate is kept in a safe location, like the original. You know, I post copies conspicuously, but the original should be kept somewhere safe for each. We've, you know, run into the issue where folks have put like their primary one, let's say, in a different location. So let's say, and it's like, no, this isn't even the right certificate. So please make sure that you're noticing, okay, the right certificate is going with the right site. Because I know a lot of you folks have satellite sites and provide testing in like multiple different office locations. Okay, are there any questions on this? All right. Okay, so here's just some commonly used photos, I think.
Christy,
Yeah.
yes, when we do testing in a different site, you're saying that that certificate needs to be just displayed? Just let them know that we are legitimate, pretty much?
Yeah, so let's say you have, your primary site and then you have 2 other office locations. You're gonna, if you register as a multi-site, if you qualify as a multi-site, you're gonna want to make sure that you post that LSL registration certificate for your multi-site at each site. Now, let's say you have multi-sites, but you're doing single site per site. Either way, whether it's multi-site or single site, excuse me, you're going to want to make sure that you're posting for that specific office, that registration certificate, what we know is the CLIA waiver, right? At each location. Did that answer your question?
Do we have to take one out into the field with us? I mean, if we're doing.
No. Oh, I think you broke up. You broke up a little.
Let's say, do we post it? Oh,
Oh, you're breaking up a little. I'm having a hard time hearing you.
okay, can you hear me now? All right, so that's what I was asking. Do we have to take it out in the field with us? I mean, keep one in our testing bags.
No, you don't. I will say though, if you have a mobile testing RV, you should in a binder keep a copy there. But if you're just having your folks with their field testing rolling bags or whatever they use, going to drop-in centers, no, you don't have to take it. They don't have to take it with them. Good question.
All right, thank you.
You're welcome. I like questions, so thanks, guys. So these are just some of the examples of the testing technologies that are CLIA waived, and a lot of you have used before, right? You got your Determine, you got your Chembios, you've got your SureCheck, which used to be known as Clearview, your OraQuick HIV, OraQuick HCV, the Insties, your Unigold, and your Syphilis Rapid Health Check. These are the most commonly ones that all of you folks use for Rapid HIV, and this is the only one for Rapid HCV, the OraQuick currently that's CLIA approved. But if you are using additional ones, please make sure you go to these links and the links I mentioned in the slides prior, which you'll get, to make sure that you type in the testing technology that you're using to make sure it's CLIA waived. And this is just a fun slide with pictures on it that basically just shows a lot of what you're, this isn't going to be everything that you need, but it's a lot of what you need, right? You need your thermometers for your temps. You need your timers, your prep pads, your lancets. If you collect via venipuncture whole blood and not finger prick, this is the lancet for the finger prick, this would be the needle and the syringe. If you have phlebotomists at your agency, your test tubes, exposure control plans, biohazard bags versus sharps containers, and your urine or other samples that you might be collecting, because some of you collect more than just urine samples, and your DBS collection card. Can anybody tell me what is the difference between what we put in a biohazard bag versus what we put in a sharps container?
The biohazard bag can be punctured by the syringe.
Correct. Yep. Great. Thank you.
Cause a needle stick.
Yep. So we definitely don't want to put syringes and needles in the biohazard bag. Yep. Where would we put those?
In the red containers.
In the sharps. Perfect. Beautiful. Right. So anything that's sharp goes in the sharps container. Everything else that could contain not regular garbage, but could contain biohazard. So let's say you remember when you're doing a finger prick, you'll often wipe away the first drop of blood with that gauze. That goes in the biohazard. But if you have something like someone, blew their nose with a tissue, that doesn't need to go in biohazard. That goes into the regular garbage. All right. Thanks, everybody. Okay. This is just a testing supply list. we don't have to go over this in detail. Most of you already know this, but for those of you who might be new, this might be helpful. Once again, if you don't provide phlebotomy, venipuncture, whole blood, then you're not going to need tourniquets or syringes and needles. So this is basically a list for everything that all of you provide. So your agency may not provide all of these services, and you may not need all of these supplies. You know, for example, if you don't provide confirmatory, if you don't provide HCV tests, but you do provide HIV, you wouldn't need anything in regards to HCV. Any questions about any of these or what any of these mean, especially for folks that are new? It's a great time for questions. Okay. Oh, and I've seen people put some stuff in the chat about the biohazard versus sharps. This were perfect. So thanks. Those were great answers too. Okay. So this is kind of what your testing setup may look like, right? You got your sharps container here. You've got your in all your other supplies for your DBS collection card, in which you're only doing your DBS collection card if you received a rapid reactive HIV or HCV. We go into that a lot in my DBS training if you attended that. You got your rapid test, you got your spill pad / barrier lancets, biohazard bag setup, alcohol prep pads, gauze, all that stuff. So this is just kind of what a sample testing area may look like for you. All right. Okay, requisition and reporting forms. Please make sure that you keep the following requisition and reporting forms in your testing room at your agency, and also if you're out in the field in your locked field testing bag, whatever that may look like. The 4463, which is the infectious diseases requisition form, which is submitted along when you do the dried blood spot, the DBS collection card. So when you, like we said before, when you get a rapid reactive for HIV or HCV, a lot of you do the DBS. Some do whole blood venipuncture, but a lot of you do a DBS via finger prick. So this is the form that goes along with that. And please note, Wadsworth, our lab, right, the preferred way of submitting this form is via remote order entry on CLIMS through HCS. I know that may be very confusing. In my DBS training, we go through that in detail. So if anyone has questions on it after the training, let me know, email me, happy to go through it with everyone, or anyone, not everyone, because some of you know this information already. You know, please remember though that Wadsworth does want you to submit this form that goes along with the DBS online, but if you're unable to do it based on where you are, extenuating circumstances, computer issues, you can still submit the paper version of the form, which is on the Wadsworth website. And the paper version link is right here. Okay. The 4189, which is to provide a reporting form, that is for confirmed HIV positive results only. So New York State does not consider one rapid reactive to be a confirmed HIV positive diagnosis. That's why you have to run the DBS, the dry blood spot. So this form does not get filled out if you do an INSTI, right, and you receive a rapid reactive. This form gets filled out when you send your DBS, your confirmatory, to the lab. Wadsworth runs the test, and then they let you know, oh, yep, came back detected or reactive or confirmed. They use a lot of different language for that. So that's when this form would be filled out for confirmed HIV positive results, not a rapid reactive. I'm seeing some confused faces. It's okay. Please ask questions. One's gone. Okay. And so next, the DOH 389, which is a confidential case report form, is for confirmed reactive HCV, hepatitis C. So it's very, similar to the 4189, which is for confirmatory HIV positive results. This one, the 389, is for confirmed RNA reactive HCV, hepatitis C positive results. And once again, Wadsworth would be informing you because you're sending your collection cards to the lab, and they would be the ones reaching out to you and letting you know. And they would do that online. In a CLIMS application that everyone should have access to. So-
Christy, there's a couple questions.
Oh, good. Okay. Yes. Do you mind letting me know what they are, Liz?
Yep, Edward Manchus asks, does the New York State Department of Health provide rapid syphilis test kits?
We do not. We do provide the DBS, the dried blood spot cards, and I can include that order form. If you are funded under the division of HIV, HCV, HIV, STD, and HCV prevention, please forgive my voice. You can get free DBS supplies from me. So I'll include that order form in this email that I sent out with the slides. But no, unfortunately, we do not provide rapid test kits because the funding that we provide you under the various different contracts, the CSP, COC, so forth, is budgeted in to purchase. So you would use that funding to purchase your rapid test kits. Great question. Thank you. Liz, was there another one?
Yep, Bianca Cordero asked, will there be another DBS training?
There will. There was just one last week. There will be another one on January 12th. So we will be offering them 3 to 4 times annually. So the next one is until January 12th. There is, however, one, I'm happy to send the DBS slides to anyone who needs them. So if you do need them, please email me. My email will be on the last slide. Let me just jot that down. And I can also include them as well. So if you need the DBS slide, you're welcome to that. But there is also, if in the meantime you have testing staff, since we're only, providing the training about every 3 months, if you have testing staff that are new and need this training, there is an online self-paced module on HIVtrainingnewyork.org that I will send the link to as well. That is a great resource for folks to take. It's very comprehensive. Does that help answer everyone's questions?
Thank you.
Got it. All right. So I'm just going to take a note real quick to make sure I include all these things. So just bear with me in the email that I send out to all of you with the slides. Great. So we'll move on to the next slide. Okay, so now we're going to switch gears a little bit, and we're going to talk about training and oversight of staff conducting testing. Okay, so here are the recommended trainings on HIVtrainingnewyork.org for all new staff, or for even staff if you notice they may be struggling in certain areas and they need refreshers. These are recommended. And once again, you will get the slides, but these are all for the recommended trainings. For example, if your agency doesn't provide hepatitis C testing, then your staff wouldn't need to take implementing rapid screening for hepatitis C. So obviously, the trainings that your folks would need to take would be based on the testing that you offer at your agency. Same thing if you don't offer STI screening, even though I do think it's really good for everyone to have a general healthy knowledge of STIs. Okay, especially like trauma-informed care, right? So like that's not a requirement, obviously, but it's best practices when we're working with clients, I think, for everyone to know, trauma-informed care. Same thing with motivational interviewing. So all of these trainings, which can be found here by typing the word testing into the course list tab, are recommended. They're free of charge, and they're all provided online to all of you. So all of your new staff or staff that you feel that need a refresher, these are some great trainings that they should be taking. Okay, next. So for testing supervisors. So everything we just went over in detail about the limited service laboratory, the registration certificates. This series right here, the whole CLEP series, it's an 8-part series. I know it's long, I apologize, but this series is all on LSL requirements. So everything that we went over and then even so much more is included. So if you are the person at your agency that is going to be handling the testing program, you supervise testing staff, especially if you're the one that's going to be completing your LSL renewals and your LSL applications. Would be very important to watch. So we highly recommend anyone that would be involved in this process, go ahead and watch this 8-part series. It's video too, so it's not just like kind of watching, a PowerPoint and clicking through. It's a video which pauses as well for like kind of little quizzes and things. Okay. These two links are really helpful. I mean, please take note that CDC trainings are not New York State specific to our regs, but they are really, really helpful. So I've gone through both of these multiple times in, my 12 years in the field of HIV before coming to DOH. And I found, especially this one, the HIV testing in non-clinical settings, they're both great, but these are really, really helpful for folks that oversee testing staff. Check both of these links out. It provides a lot of program guidance and effective interventions. Okay. All right. So some supervisory oversight of your testing programs. So we've got, yes.
Before you start, we've got another question.
Shoot.
Jahara Gonzalez, with the trainings online, do we receive a certificate of completion?
You sure do. So HIVtrainingnewyork.org always automatically will send you the certificate. The reasons here why I don't provide certificates is that because we have, 80 to over 100 folks, that's a lot. and Zoom doesn't specifically provide certificates. They don't print them out and do them automatically. If they did, we would, but Zoom doesn't do that. But yes, absolutely. You will, any of the HIVtrainingnewyork.org, you will, everyone that attends will get a certificate. Great question. Liz, was that the only question?
Yes, that was the only one.
Great, thanks. Okay, so all of this information is very important, especially for if you are a person that either is new to your agency, new to testing, and you're going to be overseeing anything in regards to testing. Some required supervisory oversight, you need to have a lab director or a lab director designee. So for example, if you have an authorizing physician, your lab director, they may not do all of the things that is like required for oversight. So a lot of times you'll have what's called a lab director designee, and that's that person at your agency that trains everyone. And we have a slide on that coming up. And that goes through everything that basically oversees everything in regards to your agency's testing program. And that's coming up on the next slide. You do need to have direct oversight of staff conducting testing with clients. It will look very different though, based on your agency structure. Every agency is structured differently. So as long as you do have direct oversight in some capacity. And you do need to have a staff person assigned to oversee all areas of your testing program. So like we kind of mentioned down here, having a testing or supervisor coordinator, having a dedicated management position that's solely responsible for the oversight of all areas of your agency's testing program is best practice, but it's not required. We recognize that some agencies don't have the funding or the capability to create those positions depending on your size. So it's best practices, but not required. But it is required that someone at your agency, like we mentioned above, is designated to oversee all areas of your agency's testing program, but they can have other occupational duties. So, they can oversee other things as well, as long as you do have at least one, if not more, staff people that are assigned to oversee the large oversight of your testing program, if that makes sense. So moving on to QA, quality assurance, initial and annual testing, observation/proficiency. So your competency checks, right, are required per tester. They must be documented and kept on file. Especially when we come in for those friendly monitoring visits, we'll definitely be looking at those. So please make sure that you have documented for each tester, initial and then annual every year, proficiency reviews, competency checks, or whatever you call them. Regular QA of your testing files, standards, documentation of adherency to agency P&Ps regarding CTR, counseling, testing, and referral procedures. So for example, an example of that, like Julie mentioned earlier, is that you want to make sure to conduct monthly QA on your control logs, your temperature logs, and your master testing logs. And that's just an example. You should make sure that you adhere to the quality assurance standards you set in your agency policies and procedures. So basically the timeframes and the standards that you list in your CTR P&Ps or P&P, however you have it, if it's multiple or one large P&P, are the ones that you'll be expected to follow. So if you set, I'm going to do QA monthly of my control logs, and you don't have documentation of doing that, that's an issue. So all of the standards that you set for yourself, you need to make sure to hold yourself accountable for. So make sure that your P&Ps have detailed timeframes that are in place and they're listed in your P&Ps. And that they're adhered to and documented. Any questions on this? Okay. All right, so lab director / lab director designate. But depending on how your agency is structured, some of you, your lab director may do all of these things, but some may not. And so then you may have a lab director designee, that person overseeing your testing program. Whether it's the lab director themselves or the designee, they need to make sure that they're training all staff performing testing, conducting those initial and annual evaluations, right? Those competency proficiency checks we talked about, that they maintain that up-to-date policy and procedural manuals for all lab test performs and for all of your policies related to testing. Make sure that all the tests are performed as written in the manufacturer's package insert. Maintain complete and accurate records of the tests performed, and that they comply with other state and federal laws, including reporting of communicable diseases and other public health concerns, which we just went over a couple slides ago. Oh my gosh, we're going to be done early, which I'm sure no one's complaining about. All right, so that pretty much wraps up the majority of what we were going to cover in this webinar. Once again, if you want to take a few minutes to write this down, CLAP Limited, so CLAP Ltd at health.newyork.gov. Any questions regarding your limited service laboratory registration certificates and renewals can go to this email. If it's programmatic related questions, feel free to send to your contract manager, and you can CC me. But absolutely, if it's regarding LSL registrations, renewals, and certificates, or questions regarding those, reach out to this email. Okay. All right. So in a nutshell, that basically sums up all the condensed information we wanted to make sure. Please, as a reminder, put your name, the agency you work for, and your email in the chat, not only so we can verify your attendance, but also so that I can make sure to send you the presentation slides in a PDF version as well. I'm going to wrap up by placing my contact information here so that everyone can see it, and feel free to write it down. That's my direct office phone and my direct work email. So you're welcome to reach out to me at any time if you have questions. Okay, I know that was a lot of information. I know it was a lot of technical information and technical jargon. If you're new to this, we don't expect you to remember, understand all of this. Feel free to reach out to your contract manager and me. We can walk you through things. That's what we're here for, to provide that training, the technical assistance, and the support. All right. So I'll pause here and see if anyone has any questions. But if you don't have any questions, you're welcome to jump off. That was pretty much our training in a nutshell. And I just want to say thanks everyone for joining. Much appreciated. And thanks for bearing with me through my raspy voice.